This is a very common problem. We see it several times a day in a practice such as ours, and we're going to try to distinguish between common, uncommon, worrisome, concerning issues and how to manage them. Not all are surgical management, many are medical. It's based on the age of the patient, what their desire is for future fertility, what they're currently using, for example, for contraception. So we have a lot of topics to talk about, and it'll probably we'll probably have to cut us off in about an hour because we could talk about this for days. Women who have gone through menopause and then have bleeding, that is always an issue which needs to be at least looked into and addressed, and should never be just passed off as normal. On the other end of the spectrum, you have women who are just beginning their menstrual cycles, women of early reproductive age, the late mid-teens, for example, and there is some irregularity there that is very common and may require nothing more than reassurance that this is a normal transition for them. More problematic and sometimes more challenging are the women of reproductive age who can have all sorts of different patterns of irregularity. And part of one of the things we want to talk about, one of the things we want to chat about is the term irregular periods. We don't always say what we mean by that. And so part of this communication with the provider is defining terms. Part of what we want to chat about is how to communicate symptoms when you go speak with your physician. And I think there are some helpful hints from my side of the table on how to communicate effectively what the symptoms are to your provider that will help them make wise decisions about how to manage your problem.